Hi, this is Kathleen McCullough reviewing the expanding role of HIM professionals as a way to increase value within the revenue cycle. First, we'll look at HIM's role in revenue cycle management. HIM professionals have always had an active role in various aspects of healthcare quality management. However, the scope and volume has accelerated. Having quality at the forefront of the national agenda has inevitably opened opportunities as well as expanded professional responsibilities. Since 2004, the federal government has been driving change to escalate technology implementations towards EHRs and HIE through the transformation set in motion by the ONC. Payers are also adding pressure to the need of higher quality care. With new measurement practices on reducing error and risk in clinical care, it's more imperative that HIM professionals be able to understand, interpret, and report big data as it reflects on the revenue cycle and quality management activities. So what is revenue cycle? According to Healthcare Financial Management Association, the revenue cycle includes all the administrative and clinical functions that contribute to the capture, management, and collection of patient service revenue. This relates to the HIM department as they now play a critical role in making sure the terminology standards are up to date and consistent within the EHR system to allow for interoperability, leading to a precise and complete longitudinal patient record. The main goal is to deliver value in terms of service to the patient. Greater value equals higher level data governance. The HIM department or personnel is the main steward for understanding and overseeing these standards, specifically making sure the patient's story regarding their episode of care remains intact as it flows through the different systems used within the revenue cycle. Understanding the role of clinical terminology is the foundation of gaining value in the revenue cycle. As we move towards quality of care payment and population health initiatives, it's imperative that the EHR reflect complexities and details of care to not only back up the medical necessity for reimbursement, but also be able to identify patients as at risk or in need of additional treatment or preventive services. While it's necessary for HIM professionals to be aware of ICD-10-CM and CPT codes, it's becoming the norm to comprehend industry standards that support data exchange, such as SNOMED, LOINC, and RX norm, because their terminologies can give more precise information regarding patients' conditions. SNOMED CT is a systemized nomenclature of medicine clinical terms. It's comprehensive, multilingual, and used all over the world. It is part of Stage 2 of the Federal Initiative for Meaningful Use. It's essential for recording and sharing clinical data and can be mapped to ICD-10 for interoperability within the revenue cycle. LOINC is the Logical Observation Identifiers Names and Code System. It's the largest global standard for identifying tests and observations. It's a HIPAA-required standard for laboratory data transmission and required for meaningful use. LOINC distinguishes a given observation across 6 dimensions. Basically, LOINC records the question and SNOMED CT records the answer. RX norm encompasses all prescription medication available in the U.S. and supports drug needs for clinical practices. It's also mandated by meaningful use and a HIPAA standard for transmission of pharmaceutical information. Using these classification systems, we can expand upon the revenue cycle and add value to the organization. To create more value, we can use business intelligence, which are tools and practices used to collect, integrate, analyze, and present raw data for insightful and useful information. Insights from these tools, combined with a strong understanding of key performance indicators, can help improve healthcare revenue cycle management and its processes. BI is made up of several related activities, including data mining, online analytical processing, querying, and reporting. The benefits of business intelligence are to accelerate and improve decision-making, enhance processes and workflow, increase efficiency of the revenue cycle, increase revenue in new areas, gain competitive advantages, identify market trends, and spot business problems. Without good data at the foundation, stewarded by HIM professionals, these tools will have skewed results, which could lead management into the wrong direction if they're using these tools to steer the organization in the next best opportunity for growth, or even just to maintain current market status. Also, knowing how to use these tools and applications could help an HIM professional become more of an asset to their organization. Analytics is similar to business intelligence, except it's more forward-reaching. It helps management look ahead and predict anything from patterns of care to improvement on excess spending, therefore tying back into the revenue cycle. Under analytics, a few key trends come to light, including data mapping, integrity analysis, and predictive analysis, which includes patient forecasting. Data experts are in high demand in the healthcare industry. HIM professionals need to have the right tools and skills to transform data into meaningful information required for informed decision-making. By delivering analytics to clinicians and executives, healthcare organizations can critically evaluate care processes and aggressively pursue the best opportunities for improving outcomes in the future within a rapidly evolving healthcare landscape. Quality measurements are being more heavily relied upon as the government and standard organizations work together for a common goal of increasing quality of care. The Institute of Medicine defines healthcare quality as the degree to which healthcare services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. They have defined 6 domains in which HIM professionals should be aware of, including effectiveness, efficiency, equity, patient-centeredness, safety, and timeliness. The results of quality measurements help bring activity and data into an observable dimension. Linking this to HIM, professionals need to be actively searching for problems with data availability, accuracy, and completeness throughout the revenue cycle. Differences in definitions of basic terms and failure to meet standards of reliability, validity, and standardization could cause problems within the cycle, as anything in this area could affect the integrity of the data used to measure quality. According to AHIMA, the heart of population health information management is the understanding and governance of the sources and uses of the data, and the use of data analytics to tell the story of clinical and financial risks by converting it into quality information. PHM lowers cost by changing the focus of healthcare on not just the sick, but also the well. This allows for the revenue cycle to expand its reach and again increase value. Key elements include keeping the healthy well as possible through preventative care and preventing the chronically ill from getting sicker, therefore reducing costs. According to the IHTT report, PHM focuses partly on the high-risk patients who generate the majority of health costs and systematically addresses the preventive chronic care needs of every patient. Because the distribution of health risks change over time, the objective is to modify the factors that make people sick or exacerbate their illness. Critical success factors for professionals are having the right information on the right population at the right time. The most critical task for PHIM professionals will be to ensure the integrity of clinical information at the point of care. This ties back to the revenue cycle from the very beginning, starting with pre-registration, making sure the right information will be captured and keeps its integrity through the continuum of care and revenue cycle. This will in turn ensure the clinical documentation is appropriately coded and confidently shared across the continuum of care enterprise. As data stewards, the HIM professional is in an excellent position to guide providers through every step of the clinical documentation integrity process. As a result of these efforts, the information can be used to measure and prove that a population is getting healthier. Risk sharing is part of a healthcare reform initiative to spread the risk between payers, physicians, and patients as a need to curb expenditures. Some of these efforts include co-payments, patient engagement, and patient outreach, and for providers, risk-sharing agreement. These can be financial-based, for total cost to treat patient or the population, outcome-based, which are conditional reimbursement continuation agreements, or capitation agreements. It can be said that the future of healthcare will require alternative models of risk to allow price to align with value, in order to allow patients better access to more innovation. There is a need for a closer and continued collaboration efforts between different parties, along with the supporting infrastructure for information sharing and interoperability that HIM professionals will help facilitate. In the revenue cycle, even just communicating between payers remains complex but necessary in order to make sure each party is sharing the risk appropriately. Privacy and security management is the protection of individuals' private information, which has long been a part of health information management. But as we rely more upon technology and the exchange of information, it will be more necessary than ever to ensure compliance in privacy and security. This is vital throughout the revenue cycle, and as stewards of data governance, the HIM professional will be the point of contact for these efforts. Some of these efforts include HIPAA's privacy and security rules, HITECH Act security measures, state legislations, and ARRA's meaningful use and adoption of EHR systems. In addition to continually changing legal requirements that force professionals to constantly redefine their roles, the advent of new technology finds the HIM professional challenged to manage information. Adding to the complexity are an increase in the amount of information and pervasiveness, as well as widespread access to data with fewer industry standards, all in the midst of increasing portability and unprecedented speeds. Tying this all together, we can look at AHIMA's HIM core model, which helps define the primary role of the HIM professional. These 5 main functional areas of health information listed in the model include data capture, validation, and maintenance, data information analysis, transformation and decision support, information dissemination and liaison, health information resource management and innovation, and information governance and stewardship. Using these core functions, we can conclude that with a solid foundation of terminology and classification systems that I previously identified, we can expand our roles and become greater assets in other business areas related to the revenue cycle and maintain integrity of data throughout the process. On a larger scale, healthcare information quality professionals must be able to motivate and influence people at all levels of the organization. They must be able to apply business intelligence and statistical analysis skills when measuring and analyzing performance. They must be able to manage quality improvement projects and employ process improvement techniques to resolve performance challenges. They must also be able to develop, deploy, and evaluate evidence-based practice recommendations that support organized-wide continuation improvements efforts and nationwide reform efforts, including population management and risk sharing. Lastly, they must work together with compliance and IT to ensure privacy and security of all data through the revenue cycle. This will affect all stakeholders, including providers, payers, and ultimately consumers, by delivering the quality healthcare they deserve at a value they feel is comparable industry-wide. These are the resources that I used.